Hi, I'm creating this video to help share my experience of what it was like to be hospitalized during the pandemic of COVID-19. I was not hospitalized with COVID-19, but I do have a chronic illness and it required hospitalization, of which this time it was very scary. And so the purpose of this video is to help anybody else that might be facing a hospital visit or hospitalization during this time of uncertainty. Okay, so what does this all entail? Basically, because of the epidemic, to keep us all safe, we are staying home. I live in Michigan, and we have a stay-at-home order. It does, at this time, feel like we are living in a movie, and it's unreal. Things unravel daily. Facts, figures, research that they once believed is no longer valid. So there is a lot of uncertainty. Now, when you live with a chronic illness already, there's always uncertainty. I'm just going to give you my best experience of what I did to help me navigate getting to the hospital when the epidemic is going on. Now, from everything that you've seen on the news, you'll hear that you need to contact your primary doctor before going to a testing center for COVID-19. Well, I was sick and I did not have the symptoms of COVID-19, but I knew that I needed to go to the emergency room. I have a chronic illness. I have a couple, but I'm immune compromised. I have lupus, I have a kidney transplant. I know that I've been having a hard time fighting infections because of my immune system. Lucky me, I usually get sick on the weekend. Not planned, but you know how inconvenient that is. I knew that I needed to be seen, and it wasn't a weekend. I wouldn't just call my primary care doctor. If it had been a weekday, I would have called my primary care doctor and let him help me navigate what the best path was to get me treated. But it was a Sunday when I went in. So what I did was I called the ER and I explained my symptoms. I explained I knew I needed to be seen, that I was pretty sure that I had an infection, and I was concerned because I was immune compromised and I did not want to come in contact with anybody with COVID-19. Well, that's a loaded question, Patty. No, seriously, because yes, there are people that have obvious symptoms and signs of COVID that may be getting tested. And then there are people that have no signs and symptoms at all that could be a carrier. So again, that's why we are all staying home to stay safe. But I had to get out of my home. I needed to leave the safety of my home, and I needed to go to virtually a place where people are congregating with COVID. So my anxiety was high. What I was informed was that anyone having symptoms of COVID-19 would be kept separate from the people exhibiting different medical symptoms in the attempt to help keep everybody safe. When I got to my hospital, we drove up, my husband drove, we drove up to the entrance where I've been many times in this hospital room. Normally my husband would drop me off, I'd go through the door, he'd park the car and then come in along with me. We would go through a screening area with all of our stuff, making sure we were safe entering the hospital with nothing that we shouldn't have. At the time, I had a very low-grade fever of 99. I don't always run fevers when I have an infection. Basically, what he had me do was go through a special door that I'd been through before, and I noticed that there was a separate door open and a separate line of people with a different protocol going through a different door. So I went through the door and I was told to sit in a chair. The chair was 6 feet away from a desk where there was a person. Now normally I would sit right at that desk and give that person my insurance cards, my information, and she would check me in, right? Not this time. I sat 6 feet away from the person, which was safer for that person and safe for me. I didn't sign any documents using a pen, and I didn't give them my insurance information. What they did ask for was my name, date of birth, social security number. All my information is in the system because unfortunately I'm a regular at that hospital, whether it be blood draws or visits or seeing doctors that are affiliated with the hospital. I'm pretty up to date. But that being said, anybody that came in, they didn't have to hand them something and get it back and have that transmission of touching things back and forth. And we were 6 feet away. I didn't sign anything. Now normally I would go from the registration desk to a triage area where they would take my weight, my blood pressure, and my vitals. It didn't happen. As I looked ahead, normally I would see a waiting room full of people. No matter when I end up in the ER, it's always full. There was not one soul in that waiting room. Not one soul. I probably never felt safer. Until, of course, I got back to the nitty-gritty part of the hospital, right? So moving along, instead of going to triage, instead of waiting to be called back, I was taken right to a room in the ER. Now, my anxiety was high. I was terrified. I won't get you wrong. And my anxiety can get pretty crazy when I don't have a good handle on what's going on. And I didn't. Because of this coronavirus, the COVID-19, I am terrified, as I know most people are. And I know I have a lot of secondary health issues that make me high risk. And I think that just fuels my anxiety even more. But I will tell you, they did everything to help ease me and make me feel safe. They told me that they didn't want people not to come to the hospital when they needed it because of fear. They were worried that people like myself that needed to be seen by doctors and needed treatment were not coming in because of fear from the virus. When I was in the hospital room, I'll tell you some things. Well, it was the ER hospital room, if you will. It's definitely different than the actual hospital room. There was some differences. Normally when I'm in the ER room and I'm hooked up to a ton of fluids and I need to use the restroom, I'm normally allowed to walk down the hallway and use a regular restroom. I was not allowed to this time because of the infection risk from the virus. This time, all of our ERs have a toilet. Basically, it looks like a cabinet. You open the door and a toilet comes out. It's really, I don't like using it because I'm a private person and there's doors on each side, but at some point I guess you just got to give up your dignity. And giving up my dignity or getting COVID, I gave up my dignity. So that was one change. I had to use the bathroom pull-out potty in the ER room. The second thing, there was no gloves anywhere in the room. They were all outside of the room. Probably because people have been hoarding, right? And I remember that specifically because someone came in the room and they're like, oh yeah, that's right, the gloves are outside. The other thing is every single person that I ran into all had a mask. Not one person was not wearing a mask. And everybody was wearing gloves. And everybody took their gloves off and washed their hands. It was like clockwork. Very efficient and very thorough. So in the ER, I was able to get the tests I needed. They accessed my port. I had tons of IV fluids going through me. They ran a bunch of blood work. The phlebotomist came in, all using proper techniques, sterile. My port was accessed, sterile. I had blood cultures done, sterile. I mean, this would have been done anyway. I just feel like everything was hyped up to the fact, you know, everyone was masked, gloves, hand washing, which is how we treat this disease or prevention, right? So that was all good. I asked a million questions. Why? Because of my anxiety. My anxiety was so high, I earned myself a heart monitor and an EKG. Patty, I just couldn't believe it. It's like some things I just can't control. My anxiety is one of them. Yikes. But they did it all there in my room, didn't have to leave. They assured me that I needed to stay in the hospital, okay? I was very ill. I knew I was. I also still didn't want to be there. So it was this internal fight. I never want to be in the hospital, but this was intensified because of my fear of the unknown, the fear of the virus. So I learned a couple things. I learned that any patient that was exhibiting the COVID was in a separate area of the hospital with separate ventilation and separate staff. So any staff that are treating a patient with the symptoms are not treating other patients like myself that are immune compromised. I have great empathy for anybody dealing with the virus, and I'm glad that it is set up this way. I just have anxiety myself not wanting to get the virus because I don't feel it would be a pleasant outcome. Once I went from the ER and I was admitted to my room, a transporter, as usual, takes me on a gurney from the ER up to a hospital room. However, the ER doctor assured me that I would be in a separate location from anybody with the virus. Again, just trying to settle my anxiety. I noticed when I was on the gurney and I was being transported to the room that anybody I saw in the hallway was also wearing a mask. I noticed that there was a lot of cleaning going on. People with cleaning chemicals and solutions wiping everything down from hand railings to doors. And again, that gave me great confidence. When I was up in the room, I then realized that everyone on the floor also had gloves and a hat. In the hospital room, there was no gloves on the walls. Usually there's boxes of gloves, different sizes, small, medium, large. There was no dry erase marker. Usually there's dry erase boards, and they put your name down, the name of your nurse, the name of your nurse aide. They put on there if you're free to walk around or not, if you're fall risk, all that mumbo jumbo, the diet you're on. there was hand sanitizer on the wall. And at one point in time, I realized I was really low on the toilet paper in the room. Now we all know, I wouldn't normally talk about toilet paper, but we all know that there's a big nationwide shortage of toilet paper. Well, I didn't think I'd ever find a shortage of toilet paper in a hospital. While I wasn't shorted, there was a process of getting the toilet paper. So I had to notified my nurse that I was getting really low and I didn't know what the protocol was. And he just said, there's a new system. It's going to take a little bit of time, but I'm going to get you some. So I chuckled. I got my toilet paper, right? But again, anybody that entered my room had gloves, had a mask, took their gloves off, washed their hands. Lots of people used sanitizer. It was all very good, and I kept asking to keep my door closed. I also had a mask on, which drove me insane. So I have a lot of credit for the healthcare staff that are wearing those masks hours on end, sweating, breathing, fogging up the glasses. Everyone on the front line is doing so much for us all to stay safe and to keep them safe, to keep their families safe, and help treat anybody. I hope that none of us have to deal with the virus, but inevitable, somebody watching this might have to deal with it at some point. And just know that whether we're sitting on this side of the screen watching this video, or we're going to be on the other side someday laying in a bed dealing with the virus, I feel that there are a lot of things put in place to do the best to treat anybody that is suffering with this virus. So whether I'm coming from you today and I'm sharing my experience not having COVID but being very scared in the hospital of contracting it because of my immune system, and telling you that everybody is doing exceptionally amazing work to keep everybody safe, to knowing that if I were on the other side and knowing that people are doing their best to treat everybody they can, the hardest they can and the best they can. I have family, I have friends, I have close friends that work in all different areas of the hospital, and they are all battling it differently. So with that in mind, I just hope that if you're watching this video and you have a chronic illness and you are terrified but feel that you may have to go to the hospital, I want you to know what my experience was so that you can feel some ease, some comfort, some little bit to help you know that it's gonna be okay. So if you do run into that position and you have the ability to contact your doctor, contact your general doctor first, or if your specialist, if you feel that's important, it's pertaining to something regarding your specialist, and just take things that way. But if you need to be seen, you need to be seen, and don't let fear get in your way. These are tough times for all of us, and I hope this video finds you well. I hope it gives you some sense of security if you are ever in this situation that you do have to be seen in a hospital during these tough times, that you're going to be okay. If you have had the experience of being in the hospital at this time, would you please share your experience below? I'm sure your input could help anybody else. As always, I hope this video finds you well, and have a great day. Bye.